radiation is unfortunately a treatment that not only treats the tumour, but it also affects the good healthy tissues as well that are exposed to it. So there is a limit to how much radiation we can give to any one spot because of the healthy tissues. Most of the time when we're giving radiation, if we're giving it as a radical or attempt at a curative treatments, we give as much as the tissues will tolerate, and we know that then often we're very limited in how much we might be able to give to the same area again down the track. When we're giving radiation more as a palliative treatment, so to relieve some pressure, relieve some pain, we only give as much as we need to, so enough to relieve the symptoms, and often that is not a dosage that the healthy tissues will be significantly affected by. So it's not uncommon if someone's had treatment to their back, for example, because they've had pain in their back and they've had relief of those symptoms, but down the track, that might be months, or you might get pain again. And in that situation, we certainly would be prepared to give more treatment, so long as we're still keeping within the tolerances of the healthy tissues. So, I mean, that's why often that people would say, maybe you can't have more treatment, but that might purely be because of the amount of dosage that we've given. Sometimes it depends on the area. So if we treat a large area, we're also restricted in how much we can give. But if there's a little area that's causing a problem within that very large area, we can sometimes focus in and give a little extra treatment as well. So there's a whole lot of issues that we have to consider, particularly if we're doing retreatments. I personally think that obviously you as the patient and you as the family and the carer, it really is ultimately your decision what you want to have done. So I mean, no matter if we say, well, we can recommend it or advise it, and these are the reasons why, and these might be the side effects, but ultimately, I think it needs to be yourselves that decides if you want to have the treatment or not. We can't make you have the treatments. Just like in all things, I guess that people will have different opinions about most things. But I guess it's what you feel comfortable with, what you want. Obviously, everyone's different, but I would know with myself, my practice and with my colleagues that I do work with, that yes, there'd come times when you really get to the point that even though you'd like to be able to give treatment, or you could give treatment, but really that it's not going to help. So we do get to situations where we then say, I think that maybe that there's nothing more active along these lines that we can do. We do say that, but equally, if you're not happy with that decision, you can always then, see somebody else and check whether that's sound, and that's always a part of that process of making decisions. What people are trying to ask is, there's an impression that sometimes maybe the single treatments may not have the same durability as the more fractionated or multiple treatments, but that's only impression. So I think that's a subject of formal studies at the moment to establish. Because it'd be great if a single treatment works just as well, then you might as well just have a single treatment.
They said they just wanted to give me one single treatment. And I was a bit frightened. I thought, what sort of wattage am I going to be getting? I'd been through the single 5 ones and, that wasn't worrying me. But when it came to the single one, I was sort of frightened me. But it was just as effective as having the 5 in a row. And it just took a matter of weeks before the pain just went.
That's partly some of the consideration, because obviously with the single treatments, it is a much bigger dose. Just to give you an idea, when we give normally the 5 treatments, for example, we give 20 gray, which are the units of radiation nowadays. When we give the single treatments, we often give 6 or 8 gray in one hit. So it's quite a much bigger dosage. So certainly, if it's a very large area that needs to be treated, or if it's, as you said, somewhere that might then give some exposure to particularly the gut, that can cause nausea, or it can disturb the bowel. So you do have to look at where you need to treat and the circumstances. And obviously a shoulder, because it doesn't have the same, gut exposure and so forth, it's somewhere that will tolerate it much more easily than a hip treatment. Having said that, there are sometimes patients who have, multiple areas of pain, and you just don't know which bit to target in on. Then we do certainly do what we call half body or part body treatment. So you may in fact treat quite a big portion of someone's, maybe the whole pelvis and part of their hips and upper legs, for example. And we can do that in single treatments as well, but that certainly means sometimes the patients might have to look at coming into hospital overnight and having a drip and making sure that we can control, nausea and any bowel irritation. So it's a different treatment again, but it is possible to give single treatments to big areas, but you'd have to manage the immediate side effects as well. Part of the problem is that sometimes we don't really know what's actually causing the pain in the bone secondary. Some of it is presumably from just having the cancer there that's pushing on and pressing on structures within the bone itself. And if the treatment kills off some of those cells, even though it might not get rid of them all, it might be enough to relieve some of that pressure and irritation that's going on, and that usually has a very good result with the pain. Sometimes if there's a lesion in the bone and it's stretching some of the lining around the outside of the bone, that's often a very sensitive area. There's a lot of nerves around there. So again, if we even get a little bit of shrinkage and relieving some of that pressure and irritation, that will relieve the pain.
So is it likely that as the cancer grows again, that the pain will come back?
It's possible. And as I said, that's why often, particularly with bony lesions, we know that that sometimes we have to certainly retreat, and that's something that we do sometimes a number of times.
So how do you determine what's healthy tissue to what isn't? How do you know that whether you've had enough treatments or not?
I guess you have to know what's being treated, how much dosage has been given to what sort of area, and I guess partly based on experience from the past, knowing how much in general the tissues will tolerate. And it doesn't always apply to the individual, but that's all we have to go by. So there's no way of, there's no x-ray or test that we have to say, yes, this bone will cope with more treatment. And that's why there's often different sorts of dosing and timing for the radiation. And I think, in fact, there are actual studies that are being conducted at the moment trying to see if one single big dose is as good as having, a number of smaller doses, and to see how long those treatments sort of last for, the duration of those sorts of treatments.
Well, I found they're equally as effective. Surprisingly enough, very effective. I found radiation extremely effective. I was in an extreme lot of pain, to the point I was nearly driven mad. So I was very lucky, I think.
It's very important to have the multidisciplinary approach, having all the different, not only medical specialties, but also a lot of the other, supportive services and, psychology and physio and OT and all of that. So we know a multidisciplinary team approach is very important, for your benefit.
Yeah.
So for breast cancer, that is certainly most centres, both publicly and privately, we have meetings, regular meetings, where patients cases are discussed as a group. And even if you come from, you know, a regional area, nowadays we, like for example, I'm based obviously at the Royal Brisbane, so when we have our meetings, we do teleconference into places like Bundaberg, so they join our meetings and they present their patients as well, and they, you know, take part in all the discussions. So rural centres actually teleconference in when new cases come along or problems, or looking at a point in a management where you need to look at where you're going. We try and discuss them in those forums. So most of the departments have got, you know, big machines called linear accelerators, that for those who've had the treatment, and although we can focus our treatment generally, it still treats a reasonably wide area, and our margins are, you know, are fairly big. So when you have brain secondaries, we generally treat the whole brain, because we know that the only way those cells could have gotten to the brain have been to circulate in the bloodstream, and so there could be other sites that you don't see on the scans. So as a first treatment, we usually treat the whole of the brain in case there are other little microscopic areas around. Now, as in your case, sometimes an area might recur or be persistent, but if that's just a small area, and the rest of the brain is controlled, then you would certainly consider giving a very much more focused and targeted form of radiation. So you have to be pretty pinpoint, because you don't want to treat, you know, the surrounding brain again. And that's what stereotactic is. It's a way of being able to localise and pinpoint that spot based on your scans, and then making sure that the radiation beams, which are very finely focused, only target that small area. As most people are, you know, concerned when it's anything to do with the brain, even surgery on the brain can have potential problems. As I said, with the treatments that we give, generally the dosage that we give, as I said, is designed to be tolerated by the brain tissue. Radiation can be extremely damaging to the brain, but that's particularly when it's a young brain that's being treated. So a brain that's still developing and maturing. In fact, the talk that I have to give is in fact about pediatric brain tumours next, because in the very young we avoid radiation, because we know that radiation will have very major consequences in terms of, you know, intellectual development and so forth. But in a brain that's matured and has the effect of radiation isn't going to affect that aspect of it. It shouldn't affect sort of the long-term memories that are there, but what the radiation could do temporarily is affect the ability to do the shorter-term memories. So people certainly for a time will become more forgetful and, you know, more fuzzy. Not being able to concentrate as well. These are all normal things that you would expect with this kind of brain treatment, but they are temporary, but temporary might go on for months, and that can be very frustrating, but it does gradually improve. I think what you have to balance, like all things, is the reason why you're giving the treatment. And if you're giving the treatment because someone's got secondaries in their brain, you have to think, well, if you don't have treatment, what will those secondaries do in themselves? It's interesting to hear, you know, obviously your perceptions of having the treatment, particularly to the head, because as you know, you have to normally have a mask or a shell made, which is to try and make sure your head's in the same position. It has the advantage that instead of having to put marks, you know, onto you as we would elsewhere, we can put any reference marks onto that same shell as well, so you don't physically have any marks on your face. And, certainly we know that you can sometimes see funny lights or even smell funny smells when you have the treatment that aren't actually there, but it's because when the treatment is happening, it does trigger or fire off some of the nerve endings that will cause you to feel that those things are happening when you're having the treatment.
I didn't find anything bad about it. I liked the making of the shell. It felt like a facial, and I liked being alone. I felt like I was just chilling out on the back, I actually loved the shell because I felt more in control of my head was straight and they would be hitting the right spot in my brain.
I found that was the most confronting of all my treatments that I had. It was just like lightning in your brain. And I found, as I said, that was the most confronting of my whole treatments. But I only had 5 treatments, so I could, bear it. But I think just being in the room on your own with these flashing things going through your head, as one of the radiologists said, she said, you've been a perfect patient, but she said, some people come in here, even one of the big truck drivers who came in for radium used to bring his teddy bear in with him.
I guess like with all things with treatment, there's always going to be the negative sides of any treatment, and often it's trying to balance up. As I said, what the consequences of not having treatment and of the tumour being there and what the tumour might do if you can't control it, compared to, I guess, the damage that treatments can do. And that applies to all treatments, surgical treatments, chemotherapy treatments as well. They all have their side effects. But unfortunately, radiation is one of the treatments that's notorious for having side effects, or people talk about, obviously, the side effects. I guess sometimes people forget, as we've heard, how effective it can also be for treatments, and not to be frightened of it if it's, trying to balance up the benefit of it. The effect of radiation is a cumulative one, so whether the initial treatments, obviously we're still having their effect, but it's not until you get to the very last treatment that you get the full effect of the treatment. And possibly some of these effects that you've got are because of where the tumour was, where they were targeting. Sometimes what you see when you look at scans that are done after particularly stereotactic treatments is that you will see initially a lot of swelling around where the treatment has been, because they give a really very punchy dose of radiation to a small area. And maybe part of the problem is that there's a lot of, extra swelling around that's causing problems, and that should improve with time. Most of the, if you're having a single treatment, as in a single course of treatment to the head, for the most part you would get temporary hair loss, but it should come back. So everyone's different, and for some patients it does come back a lot finer, and so it may look sparse and be a problem, and for others obviously it just comes back normally. So, and if you have multiple treatments, then obviously there's a greater risk that there will be permanent areas of hair loss. Depending on where we're having to treat, there's sort of the inner ear, which is very, very delicate and sensitive, so sometimes we can get effects on that part with the treatment.
I find that memory loss is quite a big thing now. And then I have hearing loss on my left ear. I only can hear on my right ear. There's too much noise in the room. I can't catch any words that people are talking about.
Sometimes also if patients are having a combination of chemotherapy and radiotherapy, which we sometimes sort of do now to combine together, you may have effects on the bone marrow, partly from where the radiation is given, for example, and partly from the chemo as well. And if the white cell count does fall, then just as when you're having chemotherapy, sometimes we need to give an injection to stimulate the marrow to produce more white cells.